Welcome to Chapter 13, Reducing Your Risk of Cardiovascular Disease and Cancer. Both CVD and cancer are closely related to lifestyle factors such as obesity, sedentary behavior, poor nutrition, stress, lack of sleep, tobacco use, and excessive alcohol use. More than 1 in 3 adults suffers from one or more types of CVD. It contributes to the leading cause of death in the world. Recognizing select risk factors is key to changing the course of CVD. The American Heart Association focuses on ideal cardiovascular health, ICH, rather than the mortality rates and the disease process. ICH is the absence of clinical indicators of CVD and the presence of 7 behavioral factors, health factor metrics. So, not smoking, sufficient physical activity, a healthy diet, an appropriate energy balance, and normal body weight, optimal total cholesterol without medication, optimal blood pressure, and optimal fasting blood glucose, both again without medication. Only 13% of U.S. adults meet 5 or more metrics with ideal levels. Fewer than 1% meet all 7. The cardiovascular system is the network of organs and vessels through which blood flows as it carries oxygen and nutrients to all parts of the body. The atria are the 2 upper chambers which receive blood. Ventricles are the heart's 2 lower chambers which pump blood through the blood vessels. Arteries carry oxygenated blood away from the heart, except for the pulmonary arteries, which carry deoxygenated blood to the lungs. Arterioles are branches of arteries. Veins carry blood back to the heart from the other regions of the body. Venules are branches of veins. And sinoatrial node is a cluster of electric pulse generating cells that serves as a natural pacemaker for the heart. The heart has 4 chambers that work together to circulate blood constantly throughout the body. The 2 upper chambers are the atria. They receive blood from the rest of the body. And the 2 lower chambers are ventricles, and they pump blood out again. The valves regulate the flow of blood. Heart activity depends on a complex interaction of biochemical, physical, and neurological signals and involves 4 basic steps. Deoxygenated blood enters the right atrium after having been circulated through the body. From the right atrium, blood moves to the right ventricle and is pumped through the pulmonary artery to the lungs to receive oxygen. Oxygenated blood from the lungs then returns to the left atrium. And blood from the left atrium moves into the left ventricle, which pumps the blood through the aorta to all of the parts of the body. Here's a map of the United States with the major cardiovascular disease age-adjusted death rates by state. So the death rates are per 100,000 population. And I don't know, guys, we're up there. Indiana is in the orange. We're just a step below the red zone. So I think we need to take a look at what's going on within our communities that is increasing those factors of CVD. There are a number of key cardiovascular diseases. We're going to take a look at some of them here. Hypertension. It refers to sustained high blood pressure, and it's really known as the silent killer. More and more people are considered to be pre-hypertensive, which means that their blood pressure is above normal, but not yet in the hypertensive range, so that it just needs to be monitored at that point. Arterial sclerosis, coronary artery disease. It's a thickening and hardening of the arteries. It's an underlying condition in many cardiovascular health problems. Peripheral artery disease is atherosclerosis in the upper and lower extremities of, so the feet, the calves, the legs, and the arms, right? That not enough blood flow is happening in these places. So there's a hardening. Coronary heart disease. Of all the major types of cardiovascular disease, coronary heart disease, CHD, it's the single greatest killer. Heart attack is also known as myocardial infarction. Arrhythmias are irregularities in heart rhythm that occur when the electrical impulses in your heart don't work properly. So there's two common opposite ends of the spectrum. Arrhythmia continuum. Tachycardia is an abnormally fast heartbeat, and bradycardia is an abnormally slow heartbeat. Fibrillation is the beating of the heart in a sporadic, quivering pattern that results in extreme inefficiency in moving blood. It's important to make note that not all arrhythmias are life-threatening. They're sometimes triggered by stress, a lack of sleep, or excessive caffeine or nicotine consumption. You may get the fast beating in your chest. Pay attention to it, but it's not always life-threatening. Angina pectoris is a symptom of coronary heart disease that occurs when not enough oxygen supplies the heart muscle and is an indicator of underlying heart disease. Cardiomyopathy or heart failure occurs when the heart muscle is damaged or overworked and lacks the strength to keep blood circulating normally throughout the body. Blood and fluids begin to back up into the lungs and other body tissues and continue on to the feet, ankles, legs, and it results in swelling. And then we have stroke, also noted as cerebrovascular accident. And that occurs when the blood supply to the brain is interrupted. Suboptimal diet, smoking, high body mass index, high blood pressure, physical inactivity, they're all contributors to cardiovascular disease. In addition to associated CVD issues, hypertension may also lead to a slowing of cognitive function, our thought processes and abilities, and increased risk for Alzheimer's disease. Cardiometabolic risks are the combined risks that indicate physical and biochemical changes that can lead to these major diseases. So there are modifiable risks for CVD. Avoid tobacco. Cigarette smokers are 2 to 4 times more likely to develop CVD than non-smokers. And smoking doubles a person's risk for a stroke. Reduce our saturated fat from high-fat meats and dairy to a 10% of the daily diet. Cholesterol is a fatty, waxy substance found in the bloodstream and in body cells. And it plays an important role in the production of cell membranes and hormones and in other body functions. Too much blood cholesterol elevates our risk of CVD. Strive for a heart-healthy diet. Really reduce your salt intake. Consume 5 to 10 milligrams per day of soluble fiber, and consume about 2 grams per day of plant cereals. Maintaining a healthy weight. People who are overweight are more likely to develop heart disease and stroke, even if they have no other risk factors. Exercise regularly, even modest levels, right? We talked about that. 20 minutes a day of physical activity are beneficial if done regularly and over the long term. Control diabetes. Heart disease rates among adults with diabetes are 2 to 4 times higher than the rates of those without diabetes. control your blood pressure. In general, the higher your blood pressure, the greater your risk for CVD. Manage stress and get more sleep. Both acute and chronic stress may trigger acute cardiac events or even sudden cardiac death. It's actually been studied as potentially one of the leading contributors. Stress is. So it can also increase the risk of hypertension, stroke, and elevated cholesterol levels. Sleep deprivation may also increase those risks. Some risk factors for CVD cannot be prevented or controlled, such as race and ethnicity, heredity, age, and gender. Today, CVD patients have many diagnostic, treatment, prevention, and rehabilitation options. Statin drugs are chemicals that lower blood cholesterol levels. ACE inhibitors cause muscles surrounding the heart to contract, thereby lowering blood pressure. Beta blockers reduce blood pressure by blocking the effects of epinephrine and CPR. Some of the techniques for diagnosing CVD, electrocardiogram, ECG. It's a record of the electrical activity of the heart. Patients typically undergo a stress test or a nuclear stress test to just see how much. So the stress test means running on a treadmill and just seeing what the heart activity looks like. And angiography, cardiac catheterization, easy for me to say, is a procedure in which dye is injected into the heart to discover some areas that may be blocked. Positron emission tomography, PET, a PET scan, 3-dimensional images of the heart are taken as blood flows through it, so they can see if there are any blockages or what's going on. MRIs, magnetic resonance imaging, the use of powerful magnets to look inside of the body. Ultra fast computed tomography, a CT scan. It's an especially fast form of X-ray imaging of the heart. And then cardiac calcium score. And that measures the amount of calcium-containing plaque in the coronary arteries. Coronary bypass surgery helps patients who suffer from coronary blockages or heart attacks. In bypass surgery, a blood vessel is taken from another site in the patient's body and implanted to bypass blocked coronary arteries. So you hear of people who have a double bypass, triple bypass. I recently know someone who got a quadruple bypass. So they're taking those blood vessels from another site and bypassing the blocked arteries in the heart, blood vessels in the heart. Angioplasty uses a balloon to open the artery to allow blood to flow more freely. Angioplasty carries fewer risks and may be more effective in selected cases in bypass surgery. And then stents may be inserted to prop open an artery, right? So it's just a little piece of material that's put into the heart, into the artery to keep it open so the blood can come back and forth or flow the way that it needs to. So although aspirin is out there as like the blood thinner and an aspirin a day keeps the doctor away, right? Possibly reducing risk for future heart attacks for those who have already had a myocardial infarction. The benefits of an aspirin regimen for otherwise healthy adults has been pretty controversial, and it may increase risk for gastrointestinal bleeding and stroke in those that take it daily. So it's really to be careful to talk to a doctor before you put yourself on one of those regimens, and just weigh all of your options out. Thrombolysis involves injecting an agent such as tissue plasminogen activator to dissolve a clot and restore some blood flow to the heart, thereby reducing the amount of tissue that dies from ischemia. So thrombolysis helps to just dissolve clots when there's a potential in the blood, right? Coagulates clots. And so that could be beneficial in helping to reduce that if reached to the emergency room fast enough. We're going to shift our gears to cancer. And cancer is the name given to a large group of diseases characterized by the uncontrolled growth and spread of abnormal cells. It's the second leading cause of death in the United States. 5-year relative survival rates are the relative rates for survival in persons who are living 5 years after diagnosis. They are up dramatically over the past decades. Remission is when cancer is responding to treatment and under control. Patients who are considered cured show no subsequent cancer in their bodies and can expect to live long and productive lives. So we all have cancer cells within our body, but it's if those cancer cells are like, they're activated. We'll talk more about that. How does cancer develop? Well, uncontrolled growth and abnormal cellular development serving no physiological function is called a neoplasm. A tumor is a clumping of cells formed from the neoplastic mass. Malignant tumors are cancerous with abnormal looking cells that are not enclosed in a protective capsule and can spread to other organs. Benign tumors are non-cancerous. They're normal-looking cells that are enclosed in a fibrous shell and do not spread to other parts of the body. To determine if a tumor is malignant, a biopsy is done. Benign and malignant tumors differ in several key ways. Metastasis is the development of secondary malignant growths at a distance from the primary site of cancer. And so we can see here the progression of cancer from genetically altered skin cell at 1, right? This is why cancer is really beneficial to detect early. 2, the cell divides more rapidly than normal. 3, the cells change form. 4, the cells are staying in one place. We're still like, those are the good places. We want to catch the cancer in those stages. And then we get to the malignant tumor where we are noting the cancer cells invade normal tissue and enter the blood and lymph, and metastasis form at the distant site. So it starts breaking off and invading other parts of the body as well. And it goes in the direction of the blood flow. Cancer staging is a classification system that describes how much cancer has spread at the time of diagnosis. Cancers are often staged based on the TNM system, tumor, node, and metastasis. So here's a table of cancer stages, and at 0, we're at the early cancer stage when abnormal cells remain on or only in the place where they originated. Stage 1, there's a higher numbers of cancer cells indicating more extensive disease. In stage 2, there's a larger tumor size and or spread of the cancer beyond the organ in which it first developed to nearby lymph nodes and or organs adjacent to the location of the primary tumor. So there's a blend of 2 and 3. Right, just depending on how much it is spread. And then there's stage 4, cancer is spread to the other organs. So just an example of this, when my father was diagnosed with lung cancer, he wasn't diagnosed until he was at stage 3. So he had lung cancer and it was affecting other parts of his areas, right? And there was some in his lymph nodes as well. They did surgery to remove one of his lungs, and then about a month later, he was at stage 4, and it had gone into all of his organs, including his brain. and then it was just a matter of time. So it's really important, right? And if you notice anything different, if you notice a lump, a bump, a change in your skin, get it checked out, because the earlier the detection, the more treatable the cancer is. Causes of cancer are generally divided into two categories of risk factors, hereditary and acquired, or environmental. Many factors are believed to contribute to cancer development. Carcinogens are cancer-causing agents, such as chemicals in our food, the air that we breathe, the water we drink, and the homes which we live in. Lifetime risk refers to the probability that an individual over the course of a lifetime will develop cancer. Relative risk is a measure of the strength of the relationship between risk factors and a particular cancer. Certain actions are clearly associated with a greater than average risk for cancer. Tobacco use. Smoking is associated with increased risk of at least 15 different cancers. My dad, 2 packs a day, Pall Mall, no filter, just that smoke straight into his lungs. Alcohol and cancer risk. Countless studies have implicated alcohol as a risk factor for cancer. It's stressing your cells so they're not able to operate optimally. Alcohol is the one drug that affects every single cell in your body, every single organ in your body. Poor nutrition, physical activity, and obesity. Dietary choices and physical activity are some of the most important modifiable determinants of cancer. Stress and psychosocial risks. People under chronic severe stress or who suffer from depression or other persistent emotional problems show higher rates of cancer than their healthy counterparts. And then there's also reproductive and hormonal factors, excessive sun exposure, and exposure to other carcinogens as well. Scientists believe that between 5 and 10% of all cancers are strongly hereditary. Suspected cancer-causing genes are called oncogenes. Certain cancers, particularly those of the breast, stomach, colon, prostate, uterus, ovaries, and lungs, appear to run in families. There are increased factors for breast cancer, which include increased numbers of fertile or menstrual cycle years, not having children or having them later in life, recent use of birth control pills or hormone replacement therapy, and opting not to breastfeed all appear to increase the risk of breast cancer. Obesity is a key component in 1 out of 5 cancer deaths. Numerous other studies support the link between various forms of cancer and obesity. The higher the BMI, the greater the cancer risk. Chronic inflammation can lead to increased risks of cancer, particularly of the colon and digestive system. Some occupational and environmental hazards are known to cause cancer and depend on the concentration, intensity, and duration of exposure. Radiation. Ionizing radiation is the only form of radiation proven to cause human cancer. Non-ionizing radiation, produced by radio waves, cell phones, and computer screens, has not been shown to increase the risk of cancer. One 2017 study showed a relationship between radio frequency exposure and malignant brain and heart tumor development in rats. Many of the concerns about chemicals in foods center on the possible harm caused by pesticide and herbicide residues. There's also a link with infectious disease and cancer, and according to experts, over 10% of malignancies in the United States are caused by viruses, bacteria, and parasites. Viruses are believed to inject their genes into host cells and cause them to grow uncontrollably. Hepatitis B, C, and liver cancer There's viruses such as Hep B and C. They're believed to stimulate the growth of cancer cells in the liver because they are chronic diseases that cause inflammation of the liver tissue. Cervical cancer has been associated with HPV, and more than half of all cases of stomach cancer are thought to be linked to H. pylori infection. There are 4 broad classifications of cancer according to the type of tissue from which the cancer arises. Carcinomas affect the epithelial tissue and metastasize through the circulatory and lymph system. Sarcomas occur in the mesodermal or middle layer of tissues and metastasize via the blood. That's less common. They're the more virulent than carcinomas. Lymphomas develop in the lymphatic system and metastasize through the lymphatic system. Hodgkin's disease is one type of lymphoma. And leukemias occur in the blood-forming parts of the body, such as bone marrow and spleen. They are non-solid tumors and are characterized by a normal increase in white blood cells. We're not going to look at every type of cancer, but we are going to take a look at skin cancer because it's the most common form of cancer in the United States today. Malignant melanoma is really the deadliest form of skin cancer, though basal cell and squamous cell carcinoma are highly curable. We really want to detect this as early as possible. Many people don't know what to look for when examining themselves for skin cancer. And there's a real simple ABCDE rule that outlines the warning signs of melanoma. So you want to look for asymmetry, right? It's not, it's an odd shape. It's not the same on both sides. Border irregularity. The color of it, is it changing? So these are like when you're seeing like a mole or something. The diameter, is that changing? And then is it evolving? Like what is it looking like over time? It's really important to take a look at all of those things. Be mindful of differences and changes in your body. Here are 3 different types of skin cancers: malignant melanoma, basal cell carcinoma, and squamous cell carcinoma. Remember, the malignant melanoma is the most dangerous of the 3. And treatment of skin cancer really depends on the seriousness. It can include surgery, radiation therapy, cryosurgery. Anyone who overexposes themselves without adequate protection from the sun is at risk for skin cancer. Preventing skin cancer is really a matter of limiting exposure to harmful ultraviolet rays, UV rays found in sunlight. Severe sunburns during childhood can be a risk factor. Having fair skin, blonde, red, or light brown hair. And for those who don't tan easily but spend a lot of time outdoors. So it's really being mindful. Yes, our vitamin D is good and we need it, but really be protecting yourselves when you are out in the sun. The earlier the cancer is diagnosed, the better prospect there is for survival. Several high-tech tools to detect cancer have become standard. MRI, CT scan, prostate ultrasound is being investigated as a means to increase the early detection of prostate cancer. Practicing self-exams and checkups are all really, really important. So here's a quick table for screening guides for early cancer detection. So the cancer site breast cancer screening procedure is a mammogram. And it is recommended that women in their 40s and older have mammograms every 1 to 2 years. Women who are at a higher risk than average of breast cancer should talk with their healthcare provider and have mammograms before the age of 40. the cancer site of the cervix, there's a pap smear, pap test. Testing is generally recommended to begin at age 21 and to end at age 65 if results have been normal. Most women should have a pap test at least once every 3 years. There's colon and rectum. So that is a fecal blood test. And so sometimes cancer or polyps bleed. So people age 50 and older should be screened for that. People with a higher than average risk should talk with their healthcare provider about having that screening before the age of 50. Prostate. It's the prostate-specific antigen, PSA test. And some groups are encouraged yearly screening for men over the age of 50. And some advise men who are at higher risk for prostate cancer to begin screening at age 40, 45. So just be aware and do your detection and get your screenings done, because the earlier the better. Cancer treatments vary based on the type of cancer and the stage in which it's detected. Common forms of treatment include surgery to remove the tumor and surrounding tissues, stereotactic radiosurgery, also known as the gamma knife, radiotherapy, chemotherapy, combinations of some or all of the above of treatment. New ways of killing tumors and new chemotherapeutic drug cocktails are being developed regularly. Promising areas of research include the following: immunotherapy, cancer-fighting vaccines, gene therapy, and stem cell research. I truly encourage anybody who's interested to do some further research for yourself, because there are some other good therapies that are good in conjunction with this. Energy therapies. And we can talk more about those in class coming up on Thursday. Take good care of yourself, get your rest, de-stress, and I will see you all soon. Be well.